Answering additional questions about electrophysiology services is nurse practitioner Erin Gillen. How does a person know if they need a defibrillator?
We have a way of stratifying people. There are certain people who have suffered cardiac events in the past and have, as a result of a heart attack or other heart ailments, have had some death of their heart muscle. So the pumping function of their heart is weaker than it should be. In that state, we know through research that those people are at higher risk of having cardiac events that could be life-threatening. So that is sort of one subset of people that we try to capture by checking your ejection fraction or the pumping function of your heart. And if that number is low, then we look into whether or not you might need to have a defibrillator implanted for what we call primary prevention to prevent you from having a life-threatening event. The other subset of people are people who have events and are rescued, often in the field with an AED. Those people are considered secondary prevention patients, and they get a defibrillator to prevent a future event from happening.
What actually happens when a patient comes into the device clinic?
So typically when a person comes to the device clinic, they will be seen by either myself, we have an RN who works in the device clinic, and a pacemaker technician. So often you'll come in, we'll talk about your medications and how you've been doing. Then we'll hook you up to a programmer, which is a machine that can actually read the information from the device, and we'll talk about what we see and make sure that everything's working appropriately.
How often does a patient have to come to the device clinic?
So typically after surgery, once you're discharged from the hospital, you would come to the office within 7 to 14 days. At that visit, we would make sure you have a new surgical incision, so we'd make sure that looks okay. We would test the device to make sure everything is in the right place. And then I would probably have you come back in 2 to 3 weeks just to make sure everything still looks okay. After that, we typically follow devices quarterly.
Why might a patient have to come to the device clinic so often?
Well, the reason for frequent monitoring of devices are many. The devices not only have a job to perform, but they also have a lot of diagnostic information within them so that we can query what your heart rates have been, we can query if you've had any fast heartbeats. There are some devices that also can give us a hint as to whether or not someone is retaining fluid. So for those diagnostic reasons, it's quite important. It's also quite helpful. Sometimes people come to me with symptoms, last Thursday at 3 o'clock, and they thought something happened, they thought they passed out, and I can either justify, yes, something did happen and we should do something about it, or no, I don't think this has anything to do with your heart, so either don't worry about it or look elsewhere. The other reason is that although these devices are very, very reliable, they are man-made, and there always is a possibility that something could malfunction or that something could be out of place. So that's why we're constantly monitoring how the device is functioning, the placement of the leads, the impedances, and all of those things in the office, so that we're sure that if and when you need the device to treat you, that it's going to do so.
Tell me about the cardiac resynchronization device.
Cardiac resynchronization, or CRT, is a relatively new technology, and it's actually very exciting. When people have heart damage, so if someone has suffered a heart attack or they have heart damage for other reasons, basically their hearts don't pump uniformly. So a normal heart should sort of, pump nice and uniformly. If part of the muscle has been damaged, when the heart's pumping, it's kind of flopping around in a not so uniform and not so physiologic way. With cardiac resynchronization, we can put wires on one side of the heart and the other side of the heart. So by stimulating both sides of the heart simultaneously, we can create the normal pumping action and give the patient what would typically be a more physiologic pump. That's exciting because with congestive heart failure patients, by synchronizing their heartbeat, we can often improve heart failure symptoms, reduce hospitalizations, people feel better, they can walk further, and sometimes restore them to almost normal capacity.
Finally, are there alternatives to coming into the heart center?
There are. Post-operatively, we like to see people in the office for obvious reasons. We need to inspect their incision. And since the wires are newly implanted, it's important that we determine that they stay in the right place and are functioning appropriately. After probably the second visit in the office, we then often have an option to monitor devices remotely. So there are machines that are available for a lot of our devices that patients can take home, attached to a phone source and a power line, and they can send their information to a secure internet server that we can retrieve. So whereas it used to be that people had to come to the office to see us 4 times a year, often they only have to come once a year and can have remote checks for the other 3 visits.